second lecture of general anatomy today. So the objectives of this lecture are by the end of this lecture, the students must be able to understand the following. Okay? Definition of and importance of human anatomy, basic terminology related to anatomy, okay? Learn the names of basic organizing of cells to organ and systems. Learn the names of all the systems of the body with little detail. Now the definition of anatomy is that human anatomy is the study of the structure of the human body with their location and position in the body. Okay? So the medical student should be aware of all these things. Okay? And understanding anatomy is very important for all other fields also. Medicine, surgery, other fields of medicine, nursing, dentistry, and many other fields. Now we will just see the different disciplines of anatomy. In anatomy, there are sub-subjects. So we'll see which sub-subjects are supposed to be done necessarily. So the first subject is called general anatomy, which I'm trying to do with you now. Okay? So it includes a definition and introduction to all systems, everything. It is called general anatomy, and you will be having a lecture per week when you go to the medical college for this. Okay? Then development of a human person is called embryology. It is done in a general way first, and then every system has its own embryology. Okay? So that's also done. Okay? So this will be another lecture per week. Then histology is the microscopic anatomy. That will also include general and special, and this will also be a lecture separate. Okay? Then we will come to the gross anatomy, which is mostly taught in the lab. Okay? Or by the demonstrators, and but they tell you everything with it. Okay, surface anatomy, how to mark an organ on the surface so that you know where to locate it and how to feel for it if there is any pain or problem with that organ. Okay. And also we'll do the radiological anatomy and clinical and applied anatomy. Okay, so all these are with the gross anatomy. So they are sub-subjects of gross anatomy actually. Okay? Then there is still left a system which we have not done in detail, and that is neuroanatomy, the brain and spinal cord and other nerves. This we will done in coordination with physiology together. Okay? So it is done as a common subject for both. Now these are same different subjects. I just try to portray them. General will include a lot of other things, but briefly. Then embryology will include all the stages from single cell zygote till the birth of the fetus. Okay? And histology will go with microscope and the slides, which will look like this, with staining. Okay? You will be taught the staining process also. Okay? Then gross anatomy, as it was done in previous times. Okay? These are the cadavers of those times. Okay? So surface anatomy you can see here, so the heart has been marked here. Radiological anatomy is taught after every part. Will teach the radiological anatomy of that, and clinical with the stethoscope. Okay? And neuroanatomy will be taught separately. Okay? And your book will be Keith Moore, subscribed book by the University of Health. Okay? The anatomical position is very important to understand because all organs are described in this position. That a person is standing with head upward, okay, and face directed forward, okay, arms by the side with palms facing forward, okay, and then the legs parallel, feet with toes directed forward. Okay. Now you can look in the baby diagram also, and somebody has done with the cartoon very nicely that palms are facing forward. So this you shouldn't forget. Okay. Now then we pass some imaginary planes. They're imaginary, okay, but we have to remember them always. Okay. that these are the planes which we have to refer to when describing an organ. Okay? The sagittal or median plane is passing vertically in such a way that it divides the body into a right and a left half. Okay? Then a coronal plane, okay, which is again vertical but at right angles to that of the sagittal plane, okay? And it is called coronal plane and divides the body into anterior and posterior parts. Now, horizontal planes can be passed through any part of the body, but if it is passed through the middle, then it will be dividing the body into upper and lower halves. So all these planes are important and we must remember them. An organ is superior to that organ or inferior to other organ, and medial or lateral, all this we have to tell when we are examining a patient. Okay? Terms of position definitions are in this table, okay? And I will not go with single one because all these things are found in every book, okay? And every book of anatomy will give you this sort of table, or they will give you a series of definitions in similar manner, okay? So we will study all these terms while describing the organs. Okay? So this is the table of all the positions. Okay? Then here I put the definitions and we can just do a little bit about them here. Okay? Terms of positions are anterior and or posterior, okay? But they also are called ventral and dorsal according to the animals which we study. Okay? Then superior and inferior. Medial and lateral are opposite. Medial is that which is nearer to the midline or median plane. Sagittal plane is also referred to as a median plane. And anything away from the body or going away from the midline is lateral. Okay? And proximal and distal are used usually with the limbs only, and the root of the limb, okay, where the limb is attached to the body, which anything nearer to that is proximal, anything away from that is distal. Hand is distal to the shoulder. Okay? And then we have a term is ipsilateral and contralateral. Ipsilateral is on the same side of the body, contralateral is on the other side of the body. Like right hand and left foot are contralateral. Right foot and right hand are ipsilateral. Okay? Then the lateral border of the arm is like this. Okay? And in the hand the terms are front is palmar, as we saw that a palm has to face forward. And when we turn the hand backward, it is dorsum of the hand. Okay? In the foot also we have different terms, and the dorsum of the foot is the one which you see on top, and the plantar on which you are standing, you can't see it just now. Okay? So plantar surface is underneath. Okay? And these dorsal and plantar are used in relation to the foot only. Okay? Then another position is where a patient is treated either in a supine position or a prone position with the face downwards. Okay? And one more term is superficial and deep according to the distance from the skin. Okay? Superficial is nearer to the skin or surface, and deep is deeper to the surface. Now we come to the terms of the action. Now here again I have given the table, okay? And with the diagrams, when I come to the diagrams, there I will just show you the little bit about the movements. Okay? So their actions are more than the terms of movements. Okay? Now terms of flexion and extension. Okay? They are the first ones which we learned, and they are defined as decreasing angle. In some of the common terms, they are decreasing the angle at the joint. Okay? So in shoulder we go forward, okay, for flexion, and backward, and elbow we go like this and we bring the lower part of the forearm against the upper arm. Okay? So this is flexion of the elbow, but knee is separate. Okay? In knee we are taking the leg backward, but the angle is decreasing. See, first it is 180 degree when we are standing, a little more or less, and when we flex it is going even 90, and we can even take it upward, okay, to touch the trunk. Okay? So this is extension. Okay? Then when we refer to the neck here, okay, forward is flexion, and backward is extension here. Now adduction, abduction, now they are shown in the shoulder here, all in this diagram. Okay, flexion, extension, adduction, abduction, and you rotate also sometimes. No? The humerus, you can feel it rotating laterally and medially in the long axis. Okay? And circumduction, we can subscribe a circle when we go all the movements together. Our hand will make a circle around it. So this is circumduction. And medial and lateral rotation are along a long axis. These you will understand axis and how the movement is going when you do the joints themselves in detail. Okay? Now this is the movement of pectoral girdle which is helping the shoulder joint. Okay? But they are not occurring at the shoulder joint. They are occurring at two joints, sternoclavicular and acromioclavicular of the clavicle with scapula. Okay? So there is protraction when you go forward to hit somebody, okay? And retraction when we go back. Okay? Elevation is shrugging the shoulders, and when you go back down, it is depression. Okay? And in upward movement of the arm, the scapula rotates with the shoulder joint. Okay? So we can take the shoulder joint is moving and the pectoral girdle is also moving now. Okay? Now the hip of the joint movements, okay, are also abduction, extension, flexion, extension, circumduction, and rotation also. Okay, medial rotation. You can bring the foot medially, just in a longitudinal axis. Okay? And in this diagram, we will see how the humerus is rotating, okay, and how it is an adduction and abduction. It is going around a lateral anteroposterior axis and in flexion and extension in a transverse axis. Now in trunk, okay, we can go forward and backward, okay, like in a ruku, and also lateral. Both side lateral is called flexion, lateral flexion, okay, because we are bending, okay, and decreasing the angle. Okay. Terms of, now this is a movement which occurs only in the forearm, okay? And it is a very important movement because this is a functional movement. Okay? Because with the hand in anatomical position, if you try to lift something, you will lift it with the palm and it will be held very weakly and you cannot do anything in this position. So, and also try in prone position with the dorsum of the foot facing forward, even then you will not be able to do it with force. But in this position, when we are doing supination, means that we are bringing the palm forward again, okay, and backward in the pronation. But mid-prone position is the functional position. This you will understand with the muscles when we do with the movements. Okay. Now, terms of movements of the hand are slightly different again. This is the fingers. We flex them and extend them at metacarpo and metacarpophalangeal joints. Okay, metacarpophalangeal joints. Abbreviations are used for that, those also. And abduction of the fingers is taken along the middle finger. It is in the center, and all the others are going away from it. Is abduction, and coming towards it is adduction. Abduction and adduction. Now thumb, okay, it is moving in flexion extension in the same plane as that of the palm. Okay. It goes in front of the palm and goes sideways. Okay? But in abduction, it goes forward, anatomical position, and backward. This is adduction and abduction. And then opposition, it goes and meets the fingers. Okay? And that is how the hand is becoming, in opposition, the hand becomes functional human hand. Now foot also, at the ankle joint, we do movement upward and downward, and again we are calling it flexion, but it is dorsiflexion towards the dorsum upward, and plantar flexion when you are flexing it towards the plantar surface of the foot. Okay? But another movement is here also. This is occurring at joints which are not ankle, they are talar joint, intertalar joints, and they have different names, and we will be learning it when we do this movement with the lower limb. Okay? Inversion, your sole feels inward, and eversion, the sole faces outward. Now jaw also is the only movable joint in the head. All the others are sutures, which are fixed joints or between other bones of the skull. But jaw we can move because through it we are eating, so we can open it and close it. This is called depression and elevation and depression, and we take it forward and backward, and that is protrusion and retrusion, and also side to side movements are there, okay, which are causing chewing movements, and rotation at, when you say no, okay, your head is rotating around axis, a vertebra. First, your head comes on a vertebra, which is the first vertebra. It is called atlas. Okay, then atlas goes around axis, which has a pointed process, which is called which atlas is going through. It is why it is called axis also. And the head moves along with atlas around this joint, which is called atlantoaxial joint. Thank you for listening. बीच में एनिमेशन थोड़ी थोड़ी ना होती है,
वो यहाँ पे रिकॉर्ड पे हमें इस पर क्लिक कर देना बाद में, ठीक है। अब ये थोड़ी देर में जो हमने किया है ना, वो यहाँ